Hello, my dear future nursing officers. I welcome you all once again back to the Master Nursing classes. In this very important session, we are going to cover those very important and a very high yield topic for your exam, where it is having the highest probability to strike in your exam. And these classes are prepared completely based on the complete analysis of the your last Norcet 1 to Norcet 9 completely analysis, and we are including every minor point and the major point and every concept that is much necessary to know in a very perfect, without wasting a time, in a complete clarity of the concept. So dear students, we work on the quality content that will strike in the exam. We are not going to work on the thing which is not going to be a necessary. Okay, so here the necessary thing only we are going to cover, so unnecessary thing we are completely avoiding here. Okay, so because the concept which will strike in the exam, so that one you must and should expose 2 times or 3 times. That is very important because it will come in the exam, right? So studying the thing is the another thing, and studying the important thing and implementing in the exam is the best thing. So you people have to do the best thing. All right, so let's begin this particular session with this very important golden line. Dear students, a very good evening to one and all. Very good evening to one and all. So I was little busy with our test series team, so we were revising the entire content and we were fixing those very important questions in your upcoming test, so which all are having the maximum chance of striking in the exam. Okay, so don't miss any live test because team is working really hard for your success, and we don't know which question will directly strikes with the same options in our upcoming exams. Don't miss any test. Okay, and hit all the very important test what we have given in the subject wise. Okay, especially in the pharmacology folder, that is the drugs and its side effect, and important teratogenic drugs, and drug of choice, antidote. So whatever the test we have given, atropine, adrenaline, don't miss anything because every test will give 1, 2 or 3 marks to you in your exam. Okay, yes sir. So let's begin this very important session. Completely focus yourself on the practice and practice. Definitely that is makes you perfect. Definitely that will help you to control the negative marks. Okay, so let's begin this particular session without wasting a single minute of the time. So that is focus on your practice, avoid all the distractions, right? Yes sir. Let's begin the session. So here it comes to the first question which we have discussed in the, so I have shown this question in the last class. Okay, so try to answer for this one. So almost all you people have given the correct answer. This was the assignment question of the last class. What is the primary cause of the peripheral neuritis in a patient taking the isoniazid? So the relationship of the isoniazid and the peripheral neuritis, this is the golden point and this is the 10-star point. This is very important. This is very important. Okay, so don't forget. Sir, why isoniazid will leads to the peripheral neuritis? Because this isoniazid, we will consider this one as the anti-tubercular therapy or the ATT drug. This is having the side effect of the reducing the vitamin B6 absorption. So when the isoniazid is reducing the vitamin B6 absorption and it's reducing the vitamin B6 effect on our body, so that will leads to the peripheral neuritis. So that is the reason whenever we are giving the anti-tubercular therapy, especially isoniazid, along with that one, which vitamin we have to give to the patient? This is the one form of the question, that is the vitamin B6 or the pyridoxine is must and should we have to give along with the anti-tubercular therapy because of the isoniazid side effect of the peripheral neuropathy. Okay, and another form of the question, like the patient is on the anti-tubercular therapy since from the last 3 months. Now the patient complaining about the tingling sensation and the pricking sensation over the peripheral limbs. So which is the therapeutic like therapeutic thing which we can expect in the doctor orders. So which we can expect is to replacement of the isoniazid. Okay, sorry, to replacement of the vitamin B6. So this is another form of the question, because the patient taking the isoniazid from the last 3 months means there may be a patient is having the peripheral neuritis. So that is the reason patient is complaining of the pricking, tingling sensation over the extremities, that is the peripheral. Okay, so that is the peripheral neuritis which indicates. So here we have to give the drug called as the vitamin B6 pyridoxine. So this is very important, because of the pyridoxine deficiency only the peripheral neuritis will happen. So the question here is, what is the primary cause of the peripheral neuritis in a patient taking the isoniazid? So that is the vitamin B6 or the pyridoxine deficiency induced by the our isoniazid. This is goes to the correct answer, and every one of you have chosen the very correct answer. So that is, I'm very proud of you. Okay, so let me quickly revise all the golden points about the vitamin B6, because this is important for our exam. Okay, so vitamin B6 we also called as the pyridoxine. Okay, so this is the water soluble vitamin. Sir, how we have to replace this one in a patient with the anti-tubercular therapy? IV, IM or oral? So we will give the tablet format, that is the orally. Okay, so why, sir? Why? Because this is, the anti-tubercular therapy we are going to give for the long period. Okay, so the maintain the compliance. Okay, daily we are pricking means the patient will not going to compliance with that one. He will not take it one for a prolonged time. So the oral is the best and recommended thing we will give in the along with the ATT pyridoxine we will give. That is the vitamin B6 we will give. Very important. Okay, what are the key functions we have regarding the vitamin B6? That's very important. Please do keep in your mind. This will be helpful for the amino acid metabolism. Okay, that is the protein metabolism, and helpful for the neurotransmitter synthesis. That is the GABA, serotonin, and the dopamine. These are the neurochemicals. So synthesis of the neurochemicals will happens with the help of the B6. So it means the B6 is a neuroprotective vitamin. The very important. Okay, so this will helpful for the neuronal growth. When the B6 will decreases, so the peripheral neuritis will happens. Getting the point? Yes, sir. Along with this one, this B6 will also helpful for the heme synthesis. So in the RBC formation, in the hematopoiesis process, so the synthesis of the heme happens. So with the help of the vitamin B6. So these are the important point we have on the vitamin B6 or the pyridoxine. And the most important thing, the golden points you must and should remember is, whenever the patient is taking the isoniazid, that will leads to the B6 deficiency, that will leads to the neuropathy. Patient will complain of the peripheral tingling sensations and the pricking sensation. So in order to prevent this one, so what we have to give? We have to give the pyridoxine supplementation. So orally we have to give. So this is the very important golden point you must and should remember. Okay, so here it comes to the next question. So it is the one of the faster question. Yes. Severe vitamin deficiency of the vitamin B5. Vitamin B5 is known as which syndrome? Yes. Wernicke-Korsakoff syndrome. Is this Wernicke-Korsakoff syndrome will happens by the vitamin B5? Response in the comment box, everyone who all are live to the session. So please do hit the like button. Everyone hit the like button. And if you, yes, if possible, so please do share the class with your colleagues and your friends. Okay, yes. So now response in the comment box, that Wernicke-Korsakoff syndrome happens due to which vitamin deficiency? Yes, so that is the thiamine. So this is due to the thiamine deficiency. We have seen this one already in the yesterday's class, the relationship between the thiamine and alcohol. Okay, very important. And the beriberi, again, thiamine deficiency. Wet beriberi, dye beriberi, infantile beriberi. Less than 1 year, baby is getting the beriberi, that is the infantile beriberi. And dry beriberi mainly and mostly affecting the nervous system. Wet beriberi is mainly affecting the cardiovascular systems, right? Yes, sir. So we have seen that one in the last class as a very important point. Okay, and none of these, so that is not an option. I'm eliminating. Then option D comes to the burning feet syndrome. So that is the almost all people given the correct answer. So the vitamin B5 deficiency which leads to the burning feet syndrome. So this is your Very important point to must and should remember. Now tell me, what is the a chemical name of the vitamin B5? Fadafat, do response in the comment box. We don't have the much time. So what is the vitamin B5 chemical name? So vitamin B5 chemical name is, so that is very nice. We have the pantothenic acid. So what is the full form, the full name or the chemical name of the vitamin B5? Pantothenic acid. So in deficiency disorder, so we have the classical picture, what we call as the burning feet syndrome. Very important for the exam. Just remember this much. And this is the very rarest situation and the very rare cases of the pantothenic acid we will get, because every food, every fruit, every vegetables, veg, non-veg, okay, everything is having the pantothenic acid. So very less chance of the getting the deficiency of that one. Okay, yes sir. The next question. The most common cause of the megaloblastic anemia worldwide. Worldwide, what is the most common cause of the megaloblastic anemia is the question. Megaloblastic anemia worldwide, what is the most common cause? Option A, we have the iron deficiency. Iron deficiency anemia, this is the most common type of the anemia in the pregnancy. Okay, so because of the less intake of the iron and high demand of the iron, so iron deficiency anemia will happen in the pregnancy. So now tell me, in the iron deficiency anemia, the size of the RBC is low or big, means small or big in iron deficiency anemia. So is this a microcytic or the macrocytic? Yes, this is a microcytic. The size of the RBC is going to be a small here in the iron deficiency anemia, and iron is responsible for hemoglobin. Hemoglobin is not there. Iron deficiency means hemoglobin is less, means the pigmented layer of the RBC is less. Okay, so the color of the RBC will be low. So iron deficiency anemia is the microcytic and hypochromic. What is the microcytic? Micro means small, cytic means cell. So the small RBCs will be there. Hypochromic means, hypo means less, chromic means color. Okay, so the color of the RBC is also dim. Okay, it is not a bright color RBC we have. So we have the very dim color or the light color RBC. So hypochromic microcytic anemia will happen. So here it is the megaloblastic. What is the meaning of the megalo? What is the mega? Okay, we have the mega cell. We have the mega upper. So we have mega in the sense big. Okay, so here the mega means, that is the mega means big, right? So blastic means immature. Okay, so blastic means immature. So the megaloblastic, which means we have the more immature RBC here. Okay, so more immature RBC happens due to the which condition? So I used to tell here, the megaloblastic anemia is happening means the more immature RBC we have. So this happens due to the deficiency of the vitamin B12 and deficiency of the folate. That is the vitamin B9. Okay, and the vitamin B12 is the cyanocobalamin. Okay, so this is the cyanocobalamin we have. Right? Yes, sir. So the deficiency of the vitamin B12 and the vitamin B9 is happening means we will be getting the immature RBC, because the two very important classical vitamins we require for the maturation of the RBC is the vitamin B12 and vitamin B9. So that is the reason, while explaining the anemia in the chronic kidney disease patient, so here I have explained what happens in the chronic kidney disease. So there is an very important, kidney is damaged. You know, from the kidney there is in the production of the erythropoietin will be there. Kidney is damaged means less production of the erythropoietin. Less production of the erythropoietin means less erythropoiesis. Less erythropoiesis in the sense, so less RBC. Less RBC in the sense anemia will happen. So there we are giving the a very important subcutaneous injection. So that is the E-poietin alpha. Okay, so the E-poietin is the, or the E-poietin alpha is the external ready-made erythropoietin we are giving in the form of the injection. So that is the externally we are supplementing by the subcutaneous injection. So along with the E-poietin alpha, so I told we need to give the which two very important vitamins. So that is vitamin B12 and the folate. and the iron also we will give, because this is important for the synthesis of the RBC. Iron is going to helpful for the formation of the hemoglobin, and B12, B9 are responsible for the maturation of the red blood cell. Okay, so now you tell me whether this is the one RBC, this is the another RBC. So among this A, B, so just for you use your intelligence, okay, and tell, so which one is the immature, whether this big one or the small one. Yes, remember always immature will be bigger than the mature. Okay, so immature RBC will be more big. Okay, it will be more big, more size. So when it will get matures, it will be comes to the normal size. Okay, so here we are having the deficiency of the B12 and B9. Okay, so B12 and B9 deficiency means there is no maturation of the RBC. No maturation of the RBC means we will be getting the big size RBC, that is the megaloblastic, what we can say. Okay, sir, in the option we have the both, that is the vitamin B12 deficiency and the folic acid deficiency. But sir, in the question what examiner is asked is, so that is, what is the most common cause of the megaloblastic anemia worldwide? So when the question comes to the most common cause worldwide, the answer goes to the option C, that is the folic acid deficiency. Okay, so this is the correct answer. Getting the point? Yes, sir. Yes, megaloblastic anemia happens due to the deficiency of the B12 and the B9 both. But the most common cause worldwide will be, that is our B9 folic acid. A very important point you have to keep in our mind. Okay, so here we have the very important clinical concept about the folic acid. So this particular folic acid is much and should necessary for the synthesis of the DNA during the hematopoiesis, means it will helpful in the hematopoiesis and it will helpful for the maturation of the RBC. So if in case we have the deficiency of the folic acid, means there is impaired DNA synthesis. Impaired DNA synthesis means the big RBC we have, means that is the megaloblastic anemia we have. So that is the megaloblastic anemia we have, right? Yes, sir. So very important and very clear, right? So here the big size RBC means we have, this is the macrocytic, macro in the sense big size, that is the immature. Okay, so we also say this one is the macrocytic megaloblastic anemia, because here the mean corpuscular value is more than 100 femtoliter, so which means the one RBC size among the entire volume of the RBC is bigger, so that is the macrocytic, what we can say. Okay, and the golden point, where is the site of absorption of the folic acid? What is the site of absorption of the folic acid? So the site of absorption of the folic acid is jejunum. The very important, remember we have the three very important golden points to remember here. So this is our esophagus, right sir? Yes. So here we have the stomach. Yes, sir. So this is the duodenum. Yes, sir. This is the jejunum. Yes, sir. And this is the ileum. This is the ileum. Okay, so this is the ileum. Remember three very important points. The best site of absorption of the iron is the duodenum. Okay, and the best site of the absorption of the folic acid is the jejunum. And the best site of the absorption of the vitamin B12 is our terminal ileum. The three question, any one question will strikes in your exam. Duodenum is the best site for the absorption of the iron, and the jejunum is the best site for the absorption of the folic acid, and the ileum is the best site of the absorption of the vitamin B12. So these are the very important and the very important point must and should remember for the exam. Okay, yes sir, right? So what is the site of absorption of the folic acid? That is the jejunum. So please do remember, right? So if the deficiencies of this particular folic acid is happening in the pregnancy, so this will cause the neural tube defect in the fetus. So this is very important for your exam. Okay, so the simple question, but it will strikes in the exam. Okay, which vitamin deficiency is going to cause the neural tube defect in the fetus? That is our deficiency of the folic acid. Remember, it is important, it is multiple time asked question. Yes, I know this is the simple question, but it is very high yield question and very very important question we have, right? Yes sir. So here we have the next question, so you have to answer for this one as the very important. Okay, so yes, here's the question. Chalo. Very simple question, but the concept behind the every question is the a golden points for your exam. Okay, so treatment of the pernicious anemia is primarily involves which of the following? Option E, we have the oral iron. Oral iron we will give in a pregnancy to promote the iron stores and to prevent the, yes, to prevent the anemia. So that is, we are going to give the iron in the pregnancy, that is orally, and in a non-pregnant also we will give the, okay, so weekly iron folic acid in the WIPS program, so we will give the iron. Okay, yes, so that already we have discussed in the national national programs what we have discussed. So we have the separate folder in the very important in a A2 plan and A1 plan, the national programs. So the first program only what I discussed is Anemia Mukta Bharat program. Whatever the doses table what I given there is the very important. Don't miss that one. Okay, so do cover that. Okay, so treatment of the pernicious anemia primarily involves oral iron. No, so here the pernicious anemia happens due to the which condition? So that is you have to understand here. Pernicious anemia is the a condition which happens due to the, yes, that is the vitamin B12 deficiency, and we are going to give the vitamin B12. So now tell me for how many days, sir? So if it is and the chronic vitamin B12 deficiency, and if it is due to the malabsorption, and is there any problem with the absorption of the vitamin B12, so we have to give the vitamin B12 deficiency, sorry, supplementation for the lifetime. Okay, so lifetime injection is required, so that's very important, right? So this is very important for your exam. So I am going to start the some very important golden points on the B12, so that is much necessary for your exam. Okay, so we have the vitamin B12, so we also call this one as the cyanocobalamin. Okay, so how it will get absorbed, you just, I will explain in a very short and sweet and perfect manner, so try to understand that one. So how it will get absorbed, you can see here, this is the esophagus we have. Okay, and this is the stomach, and this is the duodenum. Okay, and here it comes to the our ileum. Okay, so here it comes to the our ileum, right? Yes sir. So here in the stomach we have the cells called as the parietal cells. So what we have here, we have the parietal cells. So this cell is responsible for the release of the intrinsic factor. Okay, so yes sir. So whenever we will have the vitamin B12, it will comes in. Okay, so this particular is the vitamin B12 you consider. So this one whenever we will have, so this one will comes in, and this one will mix with the intrinsic factor. So when the intrinsic factor will binds to this one, so this one will come, this one will get absorbed in our blood by the our terminal ileum. So through the terminal ileum it will get absorbed. Very important. So for the better intake of the our vitamin B12, so here we have to have the non-veg, because in the veg we don't have the vitamin B12. So that is the reason pernicious anemia or the vitamin B12 deficiency is very predominant in a veg eating peoples. Okay, so that is who are having the non-veg, so in them, so there is very less chance of the B12 deficiency, because non-veg is high rich, or the what we can say organ meats and also those all are the high rich source of the vitamin B12. Okay, so in the non-veg people, so if they are having, so the vitamin B12 will comes here, it will be mixed with the intrinsic factor, so then it will get absorbed in the very very important terminal ileum. Now you consider the patient is a case of the Crohn's disease. Patient is the case of the Crohn's disease. Sir, what is this Crohn's disease? Crohn's disease is the a very important autoimmune inflammatory bowel disease, which is most commonly damages the terminal ileum. So tell me, what is the most common site of the Crohn's disease? So Crohn's disease most commonly damages the our terminal ileum. So I told the very important B12 is getting absorbed by the terminal ileum. So now Crohn's disease damaged the terminal ileum means there is no B12 absorption. So there is no B12 absorption means there is in the vitamin B12 is going to decrease, so that is causing the pernicious anemia. Now you consider patient is underwent for the gastrectomy, means the stomach we removed. So stomach we removed means the parietal cells we removed. Parietal cells we removed means intrinsic factor will be not there. So no intrinsic factor means no hold on the vitamin B12. So no hold on the vitamin B12 means vitamin B12 deficiency will happens. And the patient is not having the non-veg. Okay, so in a vegetarian, so the vegetarian peoples and the patient underwent the gastrectomy, so removal of the very important stomach, and the patient is having the Crohn's disease. So these all are the high risk factors of the vitamin B12 deficiency. The very important, because absorption pathway how to understand. So this requires the intrinsic factor for the absorption. So this one will be released from the parietal cells. Okay, in the gastrectomy and in the gastritis. So there is in the parietal cells may get damaged, and there is less vitamin what we can say B12 absorption because of the less intrinsic factor. Okay, and this will get absorbed in the terminal ileum. So in the Crohn's disease, that is most commonly mainly is damaging the terminal ileum. So there is the vitamin B12 deficiency will be there. Okay, so understand now the vitamin B12 deficiency, the most important for your exam. So this is the 5-star concept. Okay, so causes I already told you people, that is the pernicious anemia is the most common. So that is deficiency of the B12. Okay, so that is vegetarian diet. Okay, so not having the non-veg, gastrectomy, that is damage of the parietal cells and less intrinsic factor, malabsorption, that is the iliac disease, especially the Crohn's disease, So this concept of the Crohn's disease, damage of the terminal ileum, and the B12 deficiency may strikes in your exam. So please do remember this one. Okay, yes sir. And here it comes to the treatment. So that is the vitamin B12 injection we have to give. So this is for the lifelong in the pernicious anemia case. So this is very important. Please do keep in your mind. Okay, and here an important and very important announcement. So if any of your juniors, any of your seniors, colleagues are preparing for the upcoming Norcet 11 and Norcet 12 exams, okay, and upcoming RB exam, JIPMER, and the senior nursing officer CRE exams, if any of your juniors, seniors, colleagues, okay, classmates, any of them are preparing for, so please do recommend that this plan A1, because this is the ultimate one plan. In the one plan you are getting everything. Okay, and this plan cost is very feasible. Okay, as compared to other coaching classes, it is only less than half. Okay, so the poor students and the economically weaker students can afford this one in a very like feasible fees. Okay, and on this particular courses now the 30% and more discount is going on. You can download the Master Nursing Classes app and you can enroll from there. Okay, so what are the things you will get in the plan even? So already I have told in the previous sessions also. So the detailed theory lectures, that is from the very basic to very advanced, PDF notes for the quick revision in the apps. Okay, and daily live test series you will get until your Norcet exam and until your course validity. Subject wise test, so it is not like we are merging the any like 10 question from here, 10 question from there, and we are giving. No, it's not like that. It is perfectly purely designed subject wise test. Nowhere in the India you will get. So if we are giving the subject wise test, means one topic, all the questions you will get in one area. You are studying the theory of that topic, so you can practice MCQ. No one can stop you to make those MCQ correct in an exam, because here everything is properly and very perfectly segregated, divided, and given in front of you all, so you can easily use it and utilize it, so you can get the best rank in the exam. Okay, so this is the plan A1, is the all-in-one course you will be having. So please do download the Master Nursing Classes app. And on the test series also, so there is on the rank booster Super 60 test series also, the 50% discount is going on. Okay, so you have to use the coupon, that is the Norcet 50. So that is the Norcet 50 is the coupon, so you can use and you can claim the 50% discount. Okay, so and I told already on the plan A1 and A2. So if any one of you are preparing for the upcoming Norcet 11 and 12, so you want to only test series you want, means you go for the plan A2. So in the plan A2 you will be getting the test series for the upcoming Norcet 11 and current Norcet 10. Okay, so that is very important, right? So here is the next question. Let's see. Okay, so the next question is very simple and very important, so please do read the question and give the best answer. Okay, simple question, but the concept you will get after this one is the very important. Okay, yes sir. Which of the following is the major consequences of untreated vitamin C deficiency, that is the scurvy? So first of all, the question will strikes from here. The vitamin C deficiency, what we can call the C deficiency, we call as the scurvy. Remember, okay, vitamin C deficiency we call as the scurvy. So now you have to tell me what is the major consequences which can be detected by the untreated vitamin C deficiency. Option A, decreased bone mineral density. Decreased bone mineral density, where we will get this one will be seen in a situation where there is in the vitamin D is decreased. Okay, so vitamin D is decreased. Vitamin D is decreased means, you know, vitamin D is responsible for the absorption of the calcium, so the calcium absorption also decreased. So that time in a deficiency of the vitamin D, we will be having the less calcium, so that time decreased bone mineral density will happen. Very important. And next option B we have, that is the impaired wound healing. Okay, yes, I will keep this one aside and I will go next. That is the nerve damage and liver dysfunction. So these both are completely unrelated with the scurvy. So I am removing the option D also, and I am removing the option C also. So you know, vitamin C, so this is one of the very important and vital vitamin we have, that is responsible for the promotion of the wound healing. Sir, how, sir? How means this is responsible for the synthesis of the collagen. So the collagen is synthesizing very properly, means the wound healing will happen very fast. So that is the reason in all post-operative patients where we have taken the large abdominal incisions and large incisions where we want to promote the wound healings, so there we will definitely give the tablet Limc. So tablet Limc, it is having what? It is having the vitamin C. So that is the ascorbic acid. Okay. Yes. So this is very important. Promotion of the wound healing, especially in the post-operative patients, which vitamin is very important. So to promote the healing of the suture line and to promote the healing of the wound which we have created by the surgical instrument. So that is, we will give the Limc tablet that is having the vitamin C. So that is the ascorbic acid. So if there is in the untreated vitamin C deficiency is there, means if any small, even very small wound is happening, you consider, so that will be get impaired in the wound healing. So this is going to be a correct answer and a very important answer for your exam. So please do remember this one. Okay, yes sir. Vitamin C is the water soluble vitamin we have. This is a I told we have the two types of the vitamin. One is the fat soluble vitamin, that is the A, D, E, K, and the water soluble vitamin B and C. So in the B we have all, that is the like cyanocobalamin as the B12 and the folic acid as the B9 and the all the B complex vitamins, that is the thiamine, riboflavin, okay, all the B complex vitamins plus the vitamin C. So these are the water soluble vitamins. Okay, and A, D, E, K. So these vitamins are the fat soluble vitamins. So these vitamin C is very essential for the collagen synthesis. So collagen synthesis is happening very good, means the wound healing will happen very good. Okay, so that is the reason vitamin C is responsible for the wound healing and it will promote the wound healing. So this is best to be given in the post-operative wound healing promotion. Okay, yes sir. So the what is the vitamin C role here? So it will also helpful for the absorption of the iron. Okay, so vitamin C is most important for the absorption of the iron. So the question will come, the multiple time asked question and the nursing intervention in a patient who is taking the iron. So the patient who is taking the iron, in that patient, what is the nursing education we have to give? So don't take a iron with a milk, don't take iron with the calcium, don't take iron with the dairy and dairy products, because the calcium which will decrease the absorption of the iron. Okay, so iron and calcium never ever should be taken together. Okay, yes sir. And most importantly, how to understand, whenever you give the iron, so along with that one we will give the citrus fruit. In the citrus fruit, what we have? We have the vitamin C. So vitamin C will absorb, along with that one it will take the iron also and it will get absorbed. So which vitamin is very important for the absorption of the iron? Vitamin C is the very important for the absorption of the iron. Okay, yes sir, the very important question, right? And if you are giving a iron to a patient, so what is the education we have to give? So we have to give, take the iron with the citrus fruit juice. Okay, so that is the amla juice, that may be orange juice. Okay, so the citrus fruit juice is the very important. Along with the iron, we will give the citrus fruit juice. Very important concept for your exam, so please do keep in your mind. Okay, so this will enhances the absorption of the iron, so that is very important. Okay, and this will prevent the deficiency of the iron, so that is the vitamin C we have. Okay, so if the vitamin C is getting the deficiency, so it will cause the scurvy, so please do remember. Okay, and the symptoms of this one is the gum bleeding, very important, gum bleeding. And there may be a subcutaneous small bleeding may happen, so that is the patches, and the poor wound healing. Okay, so that is very important. And vitamin C's deficiency means, so iron also will be less absorption, so less absorbing iron means iron deficiency anemia may also be happens. Okay, and remember, this is the a 10-star golden point. Okay, so this is the 10-star golden point we have, so that is antioxidant vitamins. Okay, so vitamin C is having the very important antioxidant. Okay, so we have the three vitamins, that is the A, C, E. So we know the drugs, that is the ACE inhibitors, the pills we have. So along with this, like by using that mnemonic, can we remember this one? Yes sir. So this is the A, C and E. These all three are the very important vitamins which works as the antioxidants. Okay, so antioxidants, so please do remember. Okay, so these vitamins A, vitamin C and vitamin E, these all three are the antioxidant. Among these all three, which one is the best antioxidant or the most potent antioxidant? That is our beautiful vitamin, that is the vitamin C is the most active antioxidant vitamin. Okay, very important, right? Yes sir. And the dietary source of this one will be the citrus fruits. Okay, so that is the reason while giving the iron, so in order to promote the iron absorption, we will give the citrus fruit juice we will give. Okay, so that is we will give the amla, guava, green vegetables, so these are the having the very important rich of the our vitamin C. Okay, so the very importantly, and note this very important point also, the water soluble vitamin B complex plus C is the water soluble and fat soluble is the ADEK, so that is the very important. Okay, and here we have the next question, and this is the 10-star question for your exam, so please do choose the correct answer. According to the current neonatal guidelines, which of the following is the recommended prophylaxis for the prevention of the vitamin K deficiency bleeding in a newborn? That is the, like we have to prevent the VKDB, that is the vitamin K deficiency induced bleeding in the newborn. So which of the following is the recommended prophylaxis we have? So among the given all four options, so option A, oral vitamin K1. So oral vitamin K, we have the 1 mg after 1 week of the birth. No sir, vitamin K is not given oral route and not given 1 week after the birth. It will be given within 1 hour of the birth. So I am going to eliminate option A. So then comes to the option B. So that is the intramuscular vitamin K 1 mg at birth. The perfect, the very perfect. Okay, so we are going to give the vitamin K by the IM route. So how much sir? 1 mg. So that is at birth within 1 hour. Okay, so as per the national health mission guidelines, so we have to give the vitamin K dose based on the weight of the baby. Okay, so that previously we used to say the term this much, preterm this much. Okay, so now the NHM given the based on the weight, so we are going to decide the dose of the vitamin K. Okay, so all the very important golden points on the vitamin K in the newborn I am going to explain, so please listen this one. This is very important. The golden point what I'm explaining is the very important. Listen carefully. Okay, yes sir. So all the newborns are at the risk of the vitamin K deficiency bleeding. Sir, why? All the newborn, whether it is the term newborn, preterm newborn, low birth weight, okay, and the very low birth weight, extremely low birth weight, okay, whatever it may be the baby, all the newborns are having the highest risk of the vitamin K deficiency. So why? Because so newborn are having the very low store of the vitamin, so it will not store the vitamin in the body, especially vitamin K will be not get stored in the body. Okay, yes sir. And from where the vitamin K will synthesis, it will get stored in the liver, that is okay. It will get stored in the liver, that is okay. Where it will be get synthesis, it will be get synthesized by the bacterial flora of the our GI tract, especially large intestine. In the large intestine we have the bacteria. So those bacteria are not infectious bacteria, those are the normal bacterial flora of the our large intestines, especially in the colon. Okay, so in the colon, so we have the a very important normal bacterial flora. So those bacterial flora is responsible for the synthesis of the vitamin K. But the problem is in the newborn, the gut, the colon is completely sterile. It is not having any bacterial flora. So the bacterial flora will develop when we will eat the food. Okay, so the normal GI system function will start. So then it will slowly get start. But currently we have the complete sterile gut. Okay, so there is no bacterial flora. So there is no vitamin K synthesis. So sterile is gut. So gut is completely sterile. No synthesis of the vitamin K. We have to give it externally as an injection. And the mother who is feeding the breast milk, in the breast milk also the vitamin K is very low. Okay, so vitamin K is low in the breast milk and the sterile gut, so which is having the no bacterial flora, so no synthesis of the vitamin K, and vitamin K is not get stored in the baby's like liver, so that is the very low vitamin K storage at the birth we have. So because of this one, so that is the bleeding will happens in the babies. So in order to prevent this one, so we have to give the injection vitamin K. Sir, which vitamin K we have to give? We have the K1, K2, K3. So among all, we have to give the K1, that is the phytinadione. Okay, so that is the phytinadione we are going to give. Okay, yes sir. So vitamin K1 is the injectable form of the vitamin we have. And the route of administration, intramuscular route, is the route of administration of the vitamin K. And site of injection, that is the anterolateral aspect of the thigh. So that is which muscle, sir? That is the vastus lateralis muscle. So this is the very important. This is very important for the exam. Okay, yes sir. Site of administration of the vitamin K immediately after birth is the our anterolateral aspect of the thigh or the vastus lateralis muscle of the our baby. So the both it means same only. Okay, so this is the name of the muscle, this is the name of the site. Okay, and route of administration will be intramuscular. Okay, so I hope it is very much clear. And based on the National Health Mission guidelines, vitamin K dose schedule based on the weight. So if the baby's weight is more than 1000 gram, we are going to give the 1 mg. Less than 1000 gram, we are going to give the 0.5 mg. So this is very important. And if an examiner he is asking the term means 1 mg, preterm means 0.5 mg. So this term preterm is the old one, and the new update which was telling is more than 1000 gram baby, that is the 1 kg baby is there, 1 mg vitamin K we have to give, and the that is less than 1 kg or less than 1000 gram, so 0.5 mg we are going to give. Sir, when to give? So that is within 1 hour of the birth we have to give in both the situation. The route is intramuscular. Okay, so that is the very important one we have discussed, right? Yes sir. So to whom we have to give? We have to give to all the newborns. Okay, it is the universal prophylaxis. it is preterm, term, whatever it may be. To all the newborns we are giving. Okay, so this will prevent the vitamin K deficiency bleeding. So this is the very important one we have to keep in our mind, right? Yes. And here it comes to the next and the very important question. So please try to choose the correct answer for this one. This is also 10-star topic. Very important question. What is the standard daily dose of the vitamin D recommended for all the newborns from the birth to the 1 year of the age? Sir, why we have to give the vitamin D in the newborns is my first question. Because mother milk is very much less in the vitamin D, and vitamin D is much and should required for the baby. Why? Because baby requires the vitamin D, because vitamin D is responsible for the absorption of the calcium and phosphorus. So vitamin D is not there in the baby means there is various problems like rickets and various things will happen. Okay, so in order to prevent that one, vitamin D is very essential in the newborns. Okay, so to whom we have to give? All the newborns. So when we will start? On the day second or the day first of the life, we can start based on the stabilization of the baby. Okay, if the baby is stable, we will start the day first. Okay, and sir, how much we are going to give, sir? Sir, we are going to give, that is the answer you have to tell to me, right? Yes, well done. That is the 400 international unit we are going to give. So we are having the syrup, that is containing the 1 ml is equal to 400 international unit. So we have to give 1 ml or the 400 international unit of the vitamin D dose we have to give. So this is after the birth. Okay, so that is after birth until the 1 year of the life. So this is very important, you have to remember, and the correct answer for this question goes to the option B. So very important, please do remember. Okay, yes sir. So here we have the very important rationale for this one, and the golden points on the vitamin D. Breast milk is having the very low vitamin D, and remember iron also very low in the vitamin, like breast milk. Okay, so very low in breast milk. Okay, so breast milk is a low source of the iron, it is not a high source of the iron. Okay, yes, so here we have breast milk has the low vitamin D. Okay, and that is the reason we are going to give the vitamin D supplementation to all the newborns. Okay, so how we are going to give this one? How it is given? It is given usually in a drops or the syrup manner. So this common preparation is 400 international unit per 1 ml. So given once daily. So daily we are going to give. So what is the duration? Until the 12 months of the age or until the 1 year of the life we are going to give. Okay, yes sir. And here we have the vitamin D golden points. So the source of the vitamin D. So this is very important. The sunlight exposure, especially ultraviolet beta rays, ultraviolet B rays, are the main source of the our main and natural source of the vitamin D. Okay, so very important, please do keep in your mind. And the active form of the vitamin D, that is the activated form of the vitamin D, what we can say. So that's the calcitriol. Okay, so 125 dihydroxy cholecalciferol is the full name, and the calcitriol, you have to remember, this is the activated form of the vitamin D. Sir, where the calcitriol will get formed, sir? Where the vitamin D will get activated, sir? So vitamin D will get activated in the kidney. Okay, sir. Now tell me, sir, in a patient with a kidney disease or patient with a CKD, whether the hypocalcemia happens or the hypercalcemia will happen, sir? What is your answer, sir? Patient is having the kidney disease, hypocalcemia happens or the hypercalcemia happens, sir? Chronic kidney disease patient. Yes? Do response. Patient is having the chronic kidney disease. Hypo. Sir, why? Because the activation of the vitamin D is happening in the kidney. Now kidney is damaged, right? So no activation of the vitamin D. You know, vitamin D is very essential for the absorption of the calcium. So here kidney damaged, no activated vitamin D, no absorption of the calcium. So deficiency of the our calcium will be there, so hypocalcemia will happen. And another thing, so there is in the chronic kidney disease happen, so phosphate is not going to excrete out of the body. Hyperphosphatemia will happen. Wherever the phosphate will increase, there the calcium will decreases. Hypocalcemia will happen. The two very important reason to be remember. Okay, yes sir. So the storage form of the vitamin D we have is that is the 25 hydroxy vitamin D we have. So this is the storage form of the vitamin. Okay, so what is the function of the vitamin D, sir? Yes, this will increases the calcium and phosphate absorption from the intestine, and it will promotes the bone mineralization. So that's the very important function of the our calcium. So vitamin D we have. So vitamin D is not there means there is no calcium and phosphate absorption. So the deficiency of the calcium and phosphate means the bone will get demineralized, the osteoporosis and the osteomalacia like situation will be there. Okay, so vitamin D deficiency in the adults is going to cause the osteomalacia. So malacia in the sense the soft. Okay, so that is the like we have the various terms. So that is the various terms like malacia where we can use is the that is the for a soft. Okay, that is the osteomalacia we have, keratomalacia we have. So that is the softening of the cornea, softening of the bone. So wherever the word we will use the malacia, that is the softening. Okay, so vitamin D is getting deficiency in the adults means so no absorption of the calcium, no absorption of the phosphate, no bone like there is no any promotion of the mineralization. So that is the bone will be getting completely soft. So the osteo means bone, soft means malacia. So osteomalacia will happen in the adults. If the same vitamin D is getting deficiency in the children's, that is going to cause the rickets. Here we are going to get the craniotabs. So that is the softening of the skull bones. These skull bones will be very soft. That is called as the craniotabs. So this is a very important term to be keep in our mind. What is the meaning of the craniotabs? Craniotabs is the softening of the skull bones. Okay, and the classical picture we have here is the in the rickets, that is the bowed leg we have, and rachtic rosary will be there. So that is already have shown image in the skeletal muscular system of the rachtic rosary, where there is in the globules will be formed here. So that is the like round globules will be formed over the our costochondral junction. Okay, and here we have the delayed closure of the fontanelles. So these are the clinical pictures of the rickets. Okay, so the bowed leg or the genovarum, the very important one to be keep in our mind, which will be seen in the case of the rickets. Okay, and we have the deficiency of the vitamin D in the adults. So that is we are going to call as the osteomalacia. We are going to cause this one as the osteomalacia. Okay, so risk factors for the deficiency of the vitamin is the exclusive breastfeeding without supplementation we are going to give, and the dark skin pigmentation is there. Sorry. A risk factor for the deficiency of the vitamin D is so only we are giving the exclusive breastfeeding and we are not giving the supplementation. Like I told syrup vitamin D 400 international unit daily 1 ml we are going to give up till 1 year I told. So only exclusive breastfeeding is giving and not giving the supplementation of the vitamin D. So this will be a highest risk for the deficiency because milk is not having the vitamin D. So only we are giving the milk means we are not giving the vitamin D. So that is going to cause the rickets. Okay, and skin is completely dark and pigmented where even we are exposing to the sun rays. So there is no activation of the or there is no synthesis of the not activation, there is no synthesis of the vitamin D. So you know the vitamin D will get synthesis when we will expose to the sun rays. Okay, so dark skin is there, pigmented skin, so there no activation of the vitamin D, and there is in the less sunlight exposure is there. So the person is and the IT workers who will be in the completely in front of the computer from the morning 6 a.m. to night 9 p.m. continuously. Okay, so where he is not exposing to the sunlight only, so his bones become very weak because no vitamin D synthesis in the skin, no vitamin D activation, no calcium absorption. So the bone will get soft. So there is in the osteoporosis and the osteomalacia is going to happen. Okay, yes sir. So these are the risk factors we have for the deficiency of the vitamin, right? Yes sir. And here we have the most important next question. So we have to keep in our mind. And here it ends our all the vitamins and the very important golden points which we have discussed on the vitamin. That is going to be a very important for your exam. Okay, so here we have the next very important point. So just read the question. and try to give the best answer in the comment box. From the rationale and table, what I'm giving to you after this question is the very important, and from there you may expect one question in the ever upcoming Norcet prelims or the mains exam. Okay, and in all the state and central government exams, they will strike one question fixed on this one. Okay, so that is the color code of the vacuum we are using for collecting the samples, because that is the nursing officer works. Okay, so that is very important. We must and should know which color code, which chemical one we have to choose for the sending the samples, because doctor advising the, okay, so doctor advising the complete blood count, that's the CBC is advising, and we are sending the sample in the plain sample, means it will go to the lab, and lab people will say we will not accept this sample, the plain sample we should not do the CBC, so they will send back the this particular sample. So again you are going to prick the patient, and again you are going to collect the sample. 2 times you are pricking the patient to collect the sample, means patient will see you like this, right? So that is a practical challenge is what you are going to face if you are not choosing the proper color code to collect the sample, right? Yes, yes sir. So the collecting the sample in a proper color coded vacuum is very important. This is the nursing officer pure work, so here we have to focus. Okay, so even the students will ask you, sir, which vacuum to be used. Whenever you will be posted in the various teaching institutes, so the students will come for the posting, right? So they will ask you, sir, which vacuum we are going to use for this blood, sir, for serum electrolyte, what vacuum? So they used to ask you. So then you have to sell the answer as very confidently. Go with the red vial, go with the yellow vial, go with the lavender vial, go with the EDTA vial, go with the sodium fluoride vial. Okay, so go with the green vial, right? Getting the point? Yes. So that is very important, and almost all people given the correct answer. What color vacuum is used for the coagulation test bone marrow studies? Okay. So for the bone marrow studies coagulation test, we must and should use the green color vacuum. So this is very important for your exam, and along with this one, you have to know this chart as a very important. Okay. So first we have the red color one. So this is not having any anticoagulant. There is no any anticoagulant inside. This one we are going to use for the serology. Serology in the sense to, before every surgery, we will check the HIV status of the patient. Okay, so for the HIV, and we will check the hepatitis B, that is the HBsAg antigen we are going to check, and we are going to check the HCV virus. Okay, so these are the serologies we are going to do, and any bacteria or any virus you want to find in the serum of that patient, so we are going to use the no anticoagulant one, that is the red color one. So this is for the serology. Okay, and we are going to use this one for the biochemistry also, for the serum electrolyte. Okay, renal function test. Okay, that is the serum electrolyte, renal function test, liver function test. Okay, RFT, LFT. So in some institutes they used to write the KFT. Okay, that is the kidney function test. Both are same. Okay, so in this situation, like serum electrolyte and the plasma proteins, okay, and the RFT, LFT. Okay, so this all the situations we are going to use the again the plain vial, what we can say. So that is the red color vacuum. Okay, so for the serology and biochemistry test, usually we are going to use the red vacuum. So this is very important. Next we have the sodium fluoride. So this is the most important color you have to remember here. So this gray color one, so this is for the blood glucose estimation. So the multiple time asked question. So to send the fasting blood sugar, to send the postprandial blood sugar, so which vial we are going to use? So that is the sodium fluoride vial. So this is very, very, very important for our exam. So please do remember. So this is the very, very, very important. Sodium fluoride, that is for the glucose estimation, for the fasting blood sugar, postprandial blood sugar. Okay, so we are going to send with the sodium fluoride vial. So that is for the estimation of the blood glucose level. Okay, yes sir. And here we have the last time image based question. So that's the EDTA. So this is, you can see the lavender color we have here. So this one we are going to use for the hematological examination. So that is most importantly, we are going to use this one for the complete blood count, that is for the CBC, and for the erythrocyte sedimentation rate. Okay, and for the HbA1c. Okay, so how much glucose is attached with the hemoglobin we want to check. HbA1c we are going to use. Okay, and like HB variant analysis. So for this all things, we are going to use the most important one, that is the EDTA. So that is the lavender vial. So that is very important, right? Yes, sir. And the most important one, remember now this one, that is for the coagulation studies like a PT, APGT, and PT-INR. So that is sodium citrate. So this is the one of the very important. So as I told, in the sodium fluoride is very important for the blood glucose estimation, and the sodium citrate, this is the most important for the our coagulation. So that is the PT, APGT, and INR. So that is the very important one, you must and should remember. Okay, and here we have the heparin one, that is the green one. Okay, so this is for the bone marrow studies we are going to use. Okay, so next we have the serum separator gel. So that is the clot activator tube. So inside this one we are having the serum separation gel. So that is most importantly, whenever we will pour the blood, it will suddenly clots all the blood at the base, and it will keep the serum at the top. Okay, so all the for the serum studies we are going to use the yellow color vial, and which is usually, yellow and red is having the same uses, but the most importantly, in the yellow, so blood will clot early and serum will get separate early. Okay, so in the red, so there is in the delay in the clot of the blood and the separation of the serum. Okay, so in the yellow, so there is in the clot activator which we are using here is the, so that is the SST. So this will be going to separate the serum very early, so we can do the test very fast here. Okay, in the serum separation gel. So I hope it is very much clear to every one of you, and it is most important for your exams. So please do keep in our mind. Okay, so can I ask some question to every one of you? Yes. So can I ask some question to every one of you? Very simple questions. Just now what I have thought to you people, so that I am going to ask, right? Yes. Done. So you are a nursing officer posted in any departments in your AIMS hospital. So you want to send the fasting blood sugar in the next day morning. For the FBS, we have to send the early morning sample. So that is which vacuum channel we are going to use to send the fasting blood sample. So option A and option B, only two options I am going to give here. Option A is for the sodium citrate 3.5% and the sodium fluoride. What is your answer? For the fasting blood sample you want to send, so fasting blood sugar, so that is the FBS you want to check, the blood glucose you want to estimate. Yes, that is the sodium fluoride. All right, and you want to send the APGT, PT, INR, so that time very nice. That is the sodium citrate is for the coagulation test, right? Yes, sir. And you want to send the CBC, complete blood count you want to see. So which one? Option A is the sodium citrate, option B is the sodium fluoride, option C is the EDTA. So mention the option. Which one? For the CBC. For the CBC, HbA1c, okay, ESR. So for this one, yes, the EDTA is the correct answer. Okay, yes, sir. Now the question will strikes from here also. That is the sequence of the blood sample collection. So this is also a very important thing you have to understand. That is the sequence of the blood sample collection, right? So first and foremost, while collecting the blood sample, we are going to collect the multiple sample at the one time you consider. So we are collecting the sample for the CBC also. We are collecting the sample for the viral markers like serology, HBV, HCV, HIV, I am going to check. Okay, and I want the FBS also, or the PPBS of that patient also, and I want to know the blood culture of that particular patient also, blood culture report also I want. So doctor advised the multiple investigation at the one time. So while collecting the sample, what is the sequence we are going to follow? Sequence of the blood sample collection when the multiple tests are advised, and so that time, you know, for the CBC we are going to use the EDTA. For the viral marker, that is for the serology, we are going to use the plain red color one. Okay, and for the FBS, we are going to use the sodium fluoride, and for the blood culture, we are going to use the separate blood culture vacuotiners. Okay, so which one I am going to pour the blood first after taking the blood? So that is the sequence of collecting the samples and order of the draw of the blood, we can say. So order of the draw of the blood. So first and foremost, we are going to use this one for the blood culture, because here this particular sample we want 100% sterile. Okay, so we want this sample should be 100% sterile. Okay, so this sterile sample we want, so that is the reason we are going to collect in a blood culture bottle. First we are going to pour, after that we are going to go for the like sodium citrate vial, that is the light blue top vial, so what we have for the coagulation test. And after that we are going to go for the red one, that is the plain, what we can say, or the serum white what we can say, there we have to go. And after that yellow one, that is the gold tube also say, or the serum separator what we can say, in that one we are going to pour. After that green tube heparin. Okay, first is blood culture, then the coagulation profile, then the red tube plain, and the yellow tube, then the green tube, then the lavender tube, that is for the EDTA, and the last one will be that is the gray color one, so that is the fluoride tube. So that is for the estimation of the blood glucose level, where we are going to pour the blood. Okay, so I hope it is very much clear to every one of you. This sequence is important. If you want, you can take the screenshot. Okay, so this is the order of the draw of the blood. Okay, so this is the sequence of draw of the blood, so that is very important, and you will be getting the notes of this class in the A1 A2 plan both. Okay, so don't worry. Right, the next question is here. What color on the Shakir's tape indicates severe malnutrition on a critical condition? So sorry, or a critical condition. Simple question. What color of the Shakir's tape indicates severe malnutrition or a critical condition? What is the correct answer? What is the correct answer? Fataфat. Right? What is the correct answer? On the Shakir's tape, what color code is indicating the severe malnutrition? So this is one of the very important and very nice of you all. Okay, so that is the 10-star top question. So that is for the quick revision, very best revision. I am going to revise all the points you must and should know about this Shakir's tape reading and the malnutrition interpretation of this one. Okay, so here the severe malnutrition, which indicates the red color one. Okay, red color one. We have the Shakir's tape like this. So this is a Shakir's tape image based question you may get in your exam. So please do remember. Okay, so here we have the three colors. So this one is the red. Okay, so this one is the purely red, and this one we have the yellow, and here we have the green. So these are the three color code we have. So there is the red, yellow, green. So this question itself they will ask. So Shakir's tape includes the which of the following color except. So they will give the red, yellow, green, and one more any black anything. So they will give. So among this one, the green indicates normal. There is no malnutrition. So here it indicates the yellow. So that is the MEM, that is the MAM. I will tell what is the MAM. And the red indicates that is the SAM. I will tell what is the SAM. Okay, so this is the SAM, this is the MAM, this is the normal. Okay, so green is normal, yellow is MAM, R is SAM. So remember this one. Okay, so this is our Shakir's tape. So for what we are using, sir, this one? So we are using this one for the checking the mid upper arm circumference. MUAC we are going to check. That is the mid upper arm circumference. Sir, how we are going to check the mid upper arm circumference? Very important. Remember two anatomical points here. One is acromion process of the our shoulder and olecranon process of the our elbow. Olecranon process of the elbow, acromion process of the shoulder. So I have to come half here I have to come up here, and exactly at the middle, this is the mid upper arm circumference I am going to measure by using this particular tape. So we call this one as the Shakir's tape. Okay, and you know, in the 6 month to 5 year, okay, in the 6 month to 5 year, it is considered as the mid upper arm circumference of the baby is not going to change. It will be same. Okay, so that is the reason there is no any variation in the values as based on the age. So mid upper arm circumference is not dependent on the age. So this is age independent. A very important, what we can say, this is the age independent indicator of the malnutrition. So multiple time asked question, so very important. Let me revise all the points. Okay, so we have the Shakir's tape, so that is used for the mid upper arm circumference checking. What it means, it means the mid upper arm circumference measurement, it will reflect the any kind of the malnutrition, that may be a protein energy malnutrition or any kind of the malnutrition. Okay, so site of the measurement, just I already told you. So take a midpoint from here. So that is from the top shoulder tip, you have to come down. That is from the acromion process. From here, come down. Okay, from the olecranon process, we have to come up. That is from the elbow, we have to come up. Okay, measured on the left arm as a standard practice. We are going to use the left arm as a usual. Okay, so I already told this is the olecranon process. Come up. This is the acromion process. Come down. This exact middle one will be the site of the measurement of the mid upper arm circumference. Okay. Yes, sir. So which age group we are going to measure this one? So we are going to measure this one in a age group of the child from the 6 months to 5 year. So in this child, we will be consider that one the mid upper arm circumference will be not changing. Okay, so mid upper arm circumference will not changes. Okay, it will not be varying, depends on it as per the age. It will be same in this particular age group, 6 months to 5 year. Getting the point? So that is the reason it is not dependent on the age. It is the age independent criteria. The very important. Why start? Okay. So this is very important for your exam. From here you will get the question. Okay. And color coding we have here. That is the red color means, I told already, less than 11.5 centimeter. So this indicating the Sam, that is the severe acute malnutrition. So the asked question, already asked question, severe acute malnutrition. In a recent CRE 4 also the question was come on this one. Yes, sir. And yellow we have, that is from the 11.5 to 12. This is the that is the moderate acute malnutrition. And green we have, so this is the more than 12. This is the normal. So one thing you have to remember here. So the mid upper arm circumference is telling only about the acute malnutrition. It will not explain you about the chronic malnutrition. Getting the point? So this one is explaining only about the acute malnutrition. Okay, that may be a severe acute or that may be a moderate acute. Okay, it will not explain you about the chronic malnutrition. Remember. Okay, and I told you, so that is 6 months to the 5 year age group is the age group where the mid upper arm circumference is the same and it will not change. So that is the age independent criteria we are using, or the age independent indicator we have in the malnutrition. So the very importantly, remember, if the child is less than 6 months, it is not useful. More than 5 year, it is not useful. Remember. Okay, so that is child less than 6 months of age, it is not useful, and the children more than 5 years of the age, this is not useful. Very importantly. And remember, whenever there is in the severe acute malnutrition, that is the red color is indicating that is less than 11.5 centimeter mid upper arm circumference is coming. So that time we have to admit the child, we have to admit the bachcha to the NRC, that is the nutritional rehabilitation center. We have to admit this particular bachcha. So that is very important for your exam. So please do remember. Okay, yes sir. So this is the Shakir tape what we have. Okay, so this is the image based question, and here we have the red, that is from the less than 11.5. so this indicating the SAM, that is the severe acute malnutrition, and 11.5 to the 12.5, that is the MAM, that is the moderate acute malnutrition. Okay, and more than 12.5, that is the green one, that is the normal one. Okay, so this is the Shakir tape we are using for the mid upper arm circumference measurement, and this is the age independent indicator of the malnutrition. So multiple times strike question in your exam. So please do remember this one. This is important. Okay. Yes. And here we have the next question. Yes, so this is the very important next question you have here. Which of the following is the key characteristics of the chronic malnutrition? So you have to tell, very important. This is the assignment question for your exam. This is the assignment question. This is the assignment question we have here. So please do remember this one. And do comment your answers in the comment box. So tomorrow you will be getting the perfect explanation for this one. Okay. So which of the following is the key characteristics of the chronic malnutrition? So question is on the chronic malnutrition. Okay. So you have to tell me which best explains about the chronic malnutrition, which is best indicate about the acute malnutrition, and the best indicates about the chronic and acute both malnutrition. So that is very important. And remember, answer is not a mid upper arm circumference. So among these three you have to choose and mention. Okay, so we will meet again in the tomorrow's class with a very best explanation. So thank you so much for watching the class till here. Okay, so have a good day and keep on practicing the MCQs which we have provided. I am repeatedly telling because those are the very important for your exams. And if any one of your friends or any colleagues is preparing for the Norcet 11 and 12, so please do recommend the Master Nursing classes. And don't forget to hit the like button. If you are new to the class channel, so please do subscribe to the channel also. All right. So thank you, and thank you so much to every one of you. We will meet again. So tomorrow class will be at the 6 p.m. exactly. So tomorrow's class is not going to be late. So yesterday and today we were completely busy on your test series. Okay, so we have to relook on the things because it is near exam. We want to deliver those questions which will reflect on your computer screen. So complete focus is on that one. So the 2 days it took, so and the tomorrow's onwards the same questions, same timing class you will be getting. Okay, at the 6:30 p.m. or the 6 p.m. So I am going to put the timing in our WhatsApp channel. So please do join there also. Okay, and don't forget to download the MNC app to practice the test series and to enroll in the plan A1 A2. Okay, so thank you so much for watching till here. Bye bye. We will meet again. Thank you everyone. Jai Hind, Jai Bharat.